Howdy meowdy. So today is we are going to visit Fifi at the clinic. It's her first day, got admitted to the hospital. She's been sick and I like your clip. I'm sure you're a very happy dog. And the doggy has a nail polish. Mind you, she has her own nail polish and it's color red, I guess. So what a pampered dog. While waiting for the nurse to pick me up and, to talk about the doctor, and his doctor said,
and I looked back, we contacted Lakeland Veterinary Clinic, and it looks like Fifi had one vaccine, but never had boosters and have never had anything since.
I think so. That was last year we went.
2022 it looked like.
That was, okay.
Yeah. So, I probably didn't have enough immunity to the disease, and maybe the kittens that you picked up on the road could have brought it into the house. I don't know that for sure. We would treat the same regardless. So IV fluid therapy, it's really important that we get her eating. So I started on an appetite stimulant and then an anti-nausea medication because we need to shut down the vomiting and get nutrition done. Okay. If we can't get her eating by tomorrow, then I think that doing X-rays is going to be warranted. Okay. But hopefully we can get her started with appetite stimulant. We can get her started eating again. Okay.
Right. Yeah, I'm just worried. She's my very first. Maybe she wasn't really happy. I'm not really sure.
Yeah. Who knows what sets it up? Yeah. And stressors certainly can set them up.
Yeah, because we usually stays in the house with her. I mean, she's always around us, but then
track. She already had an antibiotic, which is in her favor because that's already in working and doing its thing.
Okay.
Okay. And then we'll just see. I told Mom that if she's not significantly better and eating by tomorrow, we're going to do X-rays and such. Okay.
Can I see her?
Yes, I'll take you where she's outside the
I was just so
isolation
worried. I told my husband I can't take it because she's been vomiting 2 days in a row, not 2 nights now. But the first night was the other
management because we know that those GI diseases can be painful. Okay. So she's going to be a little bit loopy.
Maybe because if I tried to pick her up and she was growling at me, maybe she's really.
Well, she had a high fever though too, and that was so achy.
That Monday, I was just. Because I always, every minute, I think I always check my cat, especially her, because this is special for me. And then I realized that it was, her whole body is just warm. When I'm all around with animals, but I don't know about those vaccines. And then I was like, maybe she has fever. So I told my husband that morning, I told you, go to the vet because I'm going to work. And then ask them that she has a fever and try to do whatever they can do for this cat. And then they gave her, I think, an antibiotic.
An antibiotic, a steroid, and
in
nausea
adopt the pet.
Yes.
Yeah, adopt the pet. So when she came home that night, she started vomiting. So
that oral medication they gave her.
Yeah, so that's the discoloration I told you, like the yellowish color, and then it got saliva or skin, and that's why I told him that's when I think it's not getting better. So because she is not, she's not playful and all, so we might go to the another one. So the vet in Adopt a Pet said that
pollen is so heavy it usually falls to the ground. In tropical areas, here, everything pollinates and it's everywhere.
Right.
So breathe it in. Cats and dogs breathe it in. They get it on their skin. It's everywhere.
Right. Yeah. Okay. So, yeah, I'm just happy that she's gonna be cured.
Yeah, me too.
So after talking to the doctor, so the nurse will take me to Fifi's room. And we are on our way to Fifi's room.
That's what your husband said. So it's possible she got it from him.
In a different room, so the cats and the other animals
so I
won't
just
get
gave her
to disease like Fifi. So that's her room. And I am very excited to see her. Bam, 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 bam. Look at her. That's Fifi. How are you?
But she has to wear the little cone.
I got that one too.
Yeah, I ordered them on Amazon. When pets are here, so we don't have to use the hard plastic one.
The nurse said they gave her a medicine that she doesn't like it because it's a bitter taste and makes her drool. That's why she's doing like that. Her trying to take the medicine out from her mouth. And I feel so bad about Fifi, but she's a pretty tough kitty. That's the first day at the hospital. I like the sunflower though. They took care of her very, very, very well. And she has an IV as well. So that's the nurse who took care of Fifi. They gave her wet food, dry food, treats, and whatever she likes, and she always changed the box. So I will be seeing you again tomorrow, Fifi, and stay good, okay? I will be right back. See you tomorrow. We will visit you again. Bye-bye. Chup chup.